Hi friends, I am Dr. Abdequaem. Again today a YouTube live session. I hope people join in early so that we can start our session immediately. Today we have some different. I have a different thing to tell you about different ways of prescribing. I hope people join in early so that I can start my session. Yeah, I'll wait for a minute to start. Now, lot of inquiries, lot of questions have come to me that sir, how do you enter a case or how do you prescribe in a case if you get the totality but there is no result? In every case, do we have to take the whole case? How to enter the case? This is a very important question, a very frequently asked question. People keep asking how do you enter the case and how do you prescribe? Now let me tell you, it is always a protocol in homeopathy first of all that whenever a chronic case comes to you, an acute case comes to you, basically take the case, take the whole history, repertorize, analyze, and then prescribe the medicine. But lot of time it happens that that we are not able to get the remedy in spite of a very good case taking. And then we keep redoing the case every time, and then we feel why the patient is not getting result. In this 25 years of practice, I have seen there are a lot of entry points in a case. How do you enter a case? How do you enter a case and how do you interpret a remedy? Sometimes what happens in my practice, I have seen there are ways to enter a case. Like for example, in 25 years of practice, I have seen there are some standards of prescribing in a patient. For example, I had written a beautiful CD on prescribing only on seeing the forehead. You see the forehead of the patient, you analyze the forehead and then prescribe. So prescribing through forehead, which I have made a CD. I hope you must have read. If you have not read, please read the CD. It is very interesting. Next way of entering the case which I have seen which gives me fantastic results is through dreams. Now this is a topic which you have to understand how to enter a case just by analyzing the dreams. First of all, you can enter the case by just seeing the hairs of the patient. You can enter the case by just seeing the eyes of the patient. You can enter the case by just seeing the nails of the patient, skin of the patient. The smell of the perspiration also will tell you how to enter the case. So there are different ways of prescribing. I'll just take today your time and my time in understanding how to prescribe through dreams, just because recently I have got a very interesting case, a simple case of nocturnal enuresis. Lot of doctors have taken this case, prescribed the remedies but did not get results. I will not comment who I have prescribed, but then the case came to me. And how did I enter the case? Just by knowing the dream of the patient, of the child, and a very very simple remedy came to our repertory chart. And how did I prescribe? Just by 2-3 symptoms and we got the results. This you have to understand and this you have to know. So first of all, dreams. I'll start my Google Meet in near future and take every entering the entry point of the case in detail, but today I'll just give you a trailer on how you can prescribe or enter the case just by knowing the dreams. Now first of all, you have to understand what is the meaning of the dream and why dream comes. In a simple line, I would say basically it represents the unconscious desires and wishes. Unconscious desires and wishes of the patient. Now this one line shows lot of things of understanding of the patient. Second, it basically gives signal to the brain on how the patient is thinking or how the patient is behaving in his daily life. Third, it basically gives the core symptom of the patient. Whatever if the patient is not able to understand, do in his life, he gets in his dreams. And sometimes the dreams are so particular, you can easily enter a remedy, easily enter a case just by knowing the dreams. As you all remember, there are 5 stages of sleep: stage 1, stage 2, stage 3, 4 and 5. In short, you can say light sleep stage 1, stage 2 eye movements stops and the brain waves becomes slower. Stage 3 where there is extremely slowness of the brain and the delta wave is too high. Stage 4 almost exclusively delta wave, and stage 5 that known as rapid eye movement. So dreams. I just share with you one simple case of dream with a slideshow. Just see how I prescribe the remedy. A simple case of nocturnal neurosis. I hope you can see my slide. I am sharing the slide now. I hope you are able to see the slide. Yes, I will do a slideshow and just we'll see a beautiful case of a nocturnal neurosis and how did I enter the case just by knowing the dream of the patient, just by knowing the dream of that child. So a simple case of nocturnal neurosis. My dear doctors, just see this case. Now a simple case. Patient of 11 years of age. He passes urine in his bed at night and awakens up frightened. Then changes his clothes and goes back to sleep. Problem has aggravated since 8 to 9 months. Has consulted other doctors, but this has not stopped. Mother accompanied the child to my clinic and gave the case. However, the child did not speak a word during the case inquiry. He complained that his teeth are very dirty as he does not brush his teeth. We took his case separately, asked him to explain how does he pass his day during the lockdown as they are all very forced to stay indoors. The child started crying. After calming down, he revealed that his parents quarreled too much. Both scream at each other and hit sometimes. Both his parents are working from home, thus they fight all day. His elder sister does not share his computer for his classes and throws him out of the room. He stays in the balcony for the entire day. All his friends go down to play in the parking area, but he is not allowed to leave the house. He feels lonely and scared but does not say anything to anyone out of fear of getting scolded or beaten. I hope you are understanding the case and seeing what I am speaking. You can write on the chat box if you are understanding what I am writing or what I am speaking. On further inquiry, the child said that he is very upset. He is very upset to find his bed wet in the middle of the night. Then he quietly changes his clothes and goes back to sleep, so that no one wakes him. He remembers he has had bad dreams of people fighting and killing each other like they show in Mahabharata, PUBG and other mobile games. He has stopped playing them on his phone. He wants to go to school and be with his friends because he wants to run away. Now, this was a simple case of nocturnal neurosis. Now, my dear friends, how do you interpret this case and how do you get this? You have seen a simple case. I just wanted today how to enter a case if you have not got a good case taking, or if the case taking is done and still you are not able to get the results from the patient. Yes, anybody. How do you enter this case? Can you tell me? Dr. Bhavi Jain, Dr. Meera, Dr. Slesha, lot of people are there on live. Can you enter this case? So he was prescribed by a lot of remedy, in fact by some senior doctors, my sirs, I will not name them. Beautiful case taking was done and the patient's mother told that we have been asked so many times but there was no results. He was actually 11 years of age and this problem was since years now. So in this case, how do you enter the case? Anybody? I'll wait for about a minute or two and then start. Yes, Dr. Jani, Dr. Lalit. Can you see how do you enter the case? Now, if you enter the case, you have 2-3 things which are very significantly important in the case. The child is not happy because the parents are fighting. The child cannot go down. There is a lot of suppression, because of which he gets a lot of things. So this basically remedy was prescribed by a lot of doctors, but with no avail. In this case, I got a very, very important dream to enter the case. Can anybody tell or understand what is the child going in his life, in his dream, and that's why the patient is having nocturnal neurosis? If you see the pathology, if you just see the psychology behind nocturnal neurosis, you will find that basically it is sublimation. Lot of stress, lot of anger stored, and the patient is passing during night. It relieves the patient. This is sublimation, also called as. But in an 11-year-old child, the parents were very worried what to do with the child. Can anybody get the dream? We just prescribe only on dream, and the dream sometimes come to the rescue because it is a very, very important aspect in our case taking, and sometimes you forget what to prescribe in dreams. You can understand that sublimation is one of the way that ego reduces the anxiety that can be created by unacceptable urges. Sublimation sometimes works by channelizing the negative and unacceptable impulses into behaviors that are positive and socially acceptable. This is how we have to understand the case of urination, nocturnal neurosis. So, my dear friends, this was a simple case. Can anybody tell me the remedy? See, in today's world, if an 11-year-old child is not speaking in front of the mother, that means you see the amount of suppression he has. And how is the suppression released? His dreams of what? Fighting and killing, and like they show in Mahabharata and PUBG Mobile. He has these type of dreams. He has stopped playing this. So there's a beautiful rubric in our Mater Medica, Dreams of Battle. There's a beautiful rubric called as Dreams of Battle. If you open our Mater Medica, if you open the repertory or Mater Medica, there's a wonderful remedy, Dreams of Battle. And as the child's mother told you that the child has very dirty teeth because he does not brush his teeth. Such a simple case, no hassles, nothing to interpret deeply, how to interpret a magnesium or a carcinogen or a lycopodium. No need to ask because already the history was taken of the patient. Dreams of Battle. Can anybody give me the answer? Which are the remedies which suffer from has dreams of battle? I had a case where the patient was suffering from a typical dream. He should dreams of Panipat, fighting. In that case also, I entered the case by just dreams of battle. So, can anybody give me the answer? Can anybody think what is it? Dr. Jain says ferrum metallicum. We are just Dr. Jani says ferrum metallicum. We are just basically asking you a simple question. Dr. Bungi says stramonium. You will be surprised to know, if you open the mathematics, I always say read mathematics every day. If you open the mathematics and see dreams of battle, the remedies are very few. And to add to that, a simple thing, dirty teeth. If you combine these two rubrics, you get a beautiful chart in front of you, and the remedy which I prescribed, a simple remedy which you can never think of. You can never think of in your life. You can never get this remedy because it is hardly prescribed or thought of in this type of complaints. And the remedy prescribed was allium cepa. Yes, allium cepa. And what is allium cepa? What is allium cepa? Prepared from? Yes, Dr. Bangi. Dr. Jani, allium cepa. Allium cepa, simple onions. If you repertorize this case, see the beautiful repertory chart. You just only take two rubrics, dreams of battle and dirty look of the teeth. The only remedy that comes to our mind is allium cepa. And allium cepa gave the patient very, very good results. In fact, I just gave 1 dose of allium cepa and the result was marvelous. The patient came after 7 days and he told me, sir, in 7 days only one time the patient passed urine, and for the first time the child of 11 years was talking in front of me in my clinic. So dreams come to our rescue if your interpretation of dream is very, very nice and very, very precise. So this is how you enter a case, just by going through the dreams. I hope you understood my case. I hope you understood the case, the dreams of battle. Okay, dreams of battle. So dreams of battle, a very, very important dream which has helped me to describe good remedies, simple, infrequent use remedies in my practice. Another way of approaching the case is just seeing by hairs of the patient. How you see the hairs of the patient, and if you see the hairs of the patient, you can still prescribe the remedies because the genetic code is everywhere in the body, right from hairs to nails to everywhere. Now, a simple case where the patient had told me the hairs become curly on combing. The hairs become curly on combing, and the whole case was taken by my assistant. Of course, they treated the case, they did not give results, and I prescribed only on that hair becomes curly on combing, and the remedy was mesarinum. Yes, I have got a lot of comments to continue on dream. Okay, today I'll only tell you something about dreams, my experiences of prescribing through dreams. Okay, a lot of doctors, Dr. Meera is telling me that, sir, continue on dreams. I'll tell you one case, a wonderful case of stammering. There was a wonderful case of stammering. The patient used to stammer, and his stammering was like this. I used to ask his name. What is your name? Suppose you tell me my name is Himanshu. My name is Himanshu. This is a type of stammering. And if you see your repertory, when the patient makes lots of faces before uttering a word, a wonderful remedy called stramonium. Of course, a lot of remedies like stramonium, digitalis, zinc metallicum, cicuta virosa was prescribed to the patient. With no avail, he came to me. So I basically, whenever the patient comes to us, I always ask how is the and why is the stammering, why the patient stammering in front of me. So the patient gave me history that he was from a low middle class family. He was studying in a very good school because the parent wanted him to study in a good school. So he could not maintain that high society life. He always was not called in parties, in receptions where his friends used to go and spend money. So he always had that inferiority complex. His parents used to keep telling him, don't worry, you will also earn good money one day, just keep studying. And so there was a lot of conflict within him, but because he was a matured child, he did not complain to his parents, he did not complain to his friends, he kept on taking that complex inside him, and gradually he developed stammering, and the stammering was so severe that now the people started laughing because he was stammering so much. So he was not called to, in schools, big schools, there are parties for birthday, there are birthday parties, there are parties of family get together. So the children are very used to going to parties, wearing high-fi dresses, using good mobiles, going for banquets, going for receptions. He always missed this type of parties and receptions. So the whole case taking was taken, and remedies were prescribed. The remedy did not work because we always took the prescriptions like elements from inferiority complex, or elements from not comparison. There was a lot of dominance of bullying in the children, but they did not react to the medicines. And now, how do you enter this case? Of course, when everything fails, you have to look how to enter the case. How to enter the case apart from the whole case taking. Suppressed urges, suppressed desire. I told you, you can get and see in the dream. So a very common symptom was there, suppression of his desires, not going in parties and all. This was a classical symptom the patient told me. So what is the dream and what is the patient trying to tell us? Can anybody tell me? Can anybody tell how to enter this case just by knowing the dream of the patient, and we could able to give relief to the patient by this? Yes, anybody? Of course, when you repertorize, the patient was absolutely thirstless and the patient had a lot of other symptoms, but this was the case. He started performing less in the class, he started becoming very, because he could not complete that difference of that orthodox life and the low socio-economic life with the high class. He was studying in a very big school because the parents wanted him to study there. Can you understand the case? How will you enter this case and how will you prescribe? Yes, Dr. Bangi, Dr. Jani, Dr. Aslisha, Dr. Meera, lot of doctors online. How will you enter this case? It is very important to understand what are the wills and desire of that child studying in school, but the wishes are not fulfilled, and then he's having a dream, having recurrent dreams of the same dream. Problem of stammering. Are you with me? Are you understanding what I'm telling you? Are you understanding what I'm telling you, everybody? If yes, you can write yes on the chat box so that I can know that I am on the right track and you're understanding what I'm meaning to tell you. There are different ways of describing, different ways of entering the case. Yes, anybody? Are you with me? Are you with me? Yes, anybody? Yes, Dr. Jania. So how do you interpret this case? How do you get inside this case and prescribe the remedy? Yes, Dr. Sadhna says yes, Dr. Bangi says yes. So how do you interpret this case, Doctor? Or any clues? You can be wrong, but try to at least interpret this case. A case of stammering, and the typical stammering of stammonium does not get relief to the patient. This is the dreams of the patient, and you enter the case by dreams. That may come to your rescue. Always remember. Yes, there are a lot of doctors asking me on WhatsApp that, sir, there are some dreams of falling off teeth and missing a bus, whether to prescribe. I'll answer the questions after that. But this case, let us understand first this case. I'll tell you some list of dreams which normally comes in our day-to-day practice. Don't take those dreams for prescription because they are solid dreams. For example, dreams of falling, dreams of missing a bus, dreams of not finishing the exam, dreams of losing a teeth, dreams of being locked up. See, these are all basic dreams that a lot of people dreams of seeing yourself in the mirror. These are all type of dreams, these are common dreams. Don't take these dreams of prescription. Yes, Dr. Bangi says fear of crowd or timidity. I think Dr. Bangi, you did not get the case. He has the desire and the will to go to that receptions, to the marriage halls, to the parties, but he cannot go because he cannot compete with that high society. You understand? So he's dreaming of that type of dream, that he's going to parties, he's going here, he's going there. How do you interpret this type of dreams? Whether these type of symptoms are present in a mathematica, the first question comes. Second, whether you have read this type of symptoms in your mathematica. Third, if you have not read, please, as always say, keep reading one remedy every day and you will never fail in your prescription. Simple case of stammering, and this is the remedy. Yes. So should I give you the answer or you can still try? So I'll give an answer. There's a very good symptom in a mathematica in a remedy where the patient has dreams of banquet. You know dreams of banquet? Dreams of banquet. You know the meaning of banquet, I think. Dr. Sarita, dreams of banquet. Dreams of banquet, people eating, people going there, enjoying with friends, receptions, parties. So this child, because of that inferiority complex, suffered from stammering, had dreams of banquet, had become weak, could not perform in class, absolutely thirstless. So the remedy was very clear. If you go in the mathematica and see a simple remedy, phosphoric acid. Now we gave him phosphoric acid, 200 single dose, and I don't need to tell, the patient came after 15 days, he was much better, and whole stammering went off within the span of 2 months with a single dose of phosphoric acid. This is how, if you fail in your prescription of the whole case and you cannot find how to enter the case, this is one of the point in entering the case, that is dreams. Yeah, people are asking me something about forehead and hairs. Maybe in the next YouTube live, I'll tell you something about forehead prescription. I've written a whole book on forehead, how to prescribe on forehead. So this is how you prescribe on dreams. Go and read today Mathematica of Phosphoric Acid, dreams of being in a banquet. A beautiful line is written in phosphoric acid and the same wordings is told by the patient, and see how does it connect the mind and body. The psychosomatic connection is so good, and then you can prescribe phosphoric acid, and phosphoric acid 200 single dose cured the case. So this is how I enter the case sometimes if I basically fail to understand that why the patient is not getting results. So this is how dreams of banquet of that patient. Now, if you want to ask some questions, you can ask some questions. There are a lot of questions on the WhatsApp that, sir, there are a lot of dreams which are very common, whether to take. As I already told you, you can have dreams of falling, you can have dreams of losing a teeth, you can have dreams of insect like spiders, you can have dreams of missing an exam, dreams of flying. These are all common dreams. If it is very particular, if it is very pronounced and enhanced, then you can take this for prescription. But these are very common dreams, soric dreams. If it is very recurrent, then you can always take that dream. I hope you are understanding. I hope you are understanding what I am telling you. I hope you are getting me that what I want to tell you in how to do in your practice. Yes, anybody? Did you enjoy the case of phosphoric acid? You can, I can, if you have time, I can. It's already half an hour, but still, I would like to share one of the case, a beautiful case. Yeah, so there are questions, but Let me go further. This is a question, very common question. Let me go further. So I'll just today I'll just be specific on dreams, and let us see. Yeah, so let us see one more case. I have a case where the child was surprisingly mild, gentle, and goody child. That ponds, you see the ponds that googly books. A very beautiful case of a simple child, but suffering from uh, he had a chronic problem of lymph nodes in the intestine, lymph nodes on the abdomen, and the abdomen was very painful. So, of course, he was referred to me by a senior homeopath. He was not getting good results. But surprisingly, when we asked the dream of the child, the child was so fast in answering the question that he told me, sir, I have dreams that lot of animals are biting me. I have dreams of dogs, I have dreams of cat, I have dreams of these animals, but these animals keep biting me in my dream, though I have pets, dog and cat in my house. So this is a type of dream that the child was suffering from, and then prescribed the remedy, and it was a miracle prescription because the day I gave him the remedy, third day the pain in the abdomen vanished. And we repeated the abdominal scan after a month's time, and the scan showed no demonstrable abnormality just by entering the case through dream. Now, can anybody? There are a lot of remedies. See, there are a lot of remedies in our Mater Medica, but this is a very peculiar symptoms of patient complaining that he has pet dogs, he has dogs, cat in his home, he loves pets, but he has dreams of biting, animals biting him. Now, what do you say about this dream, and how do you prescribe in these type of cases? Yes, anybody? See, there are a lot of doctors online. I would like doctors to share their experiences, because then I understand what to tell you next time on YouTube live or Facebook question answer session. It is very important for you to understand that are you getting me what I am telling you? Yes, are you with me? Yes or no? Yes, people want case taking. People want me to take webinars on lot of cases. Yeah. So, Dr. Priya Ajani has had a very beautiful answer, and that is phosphorus. But as you go further in your practice, as you go further, the patient also had had lot of craving for छाछ. मुझे छाछ पीने का बहुत शौक है. मुझे छाछ पीने का बहुत शौक है. So we combine these two symptoms, just these two symptoms, though very common, but we combined these two symptoms and a beautiful remedy came to our prescription. And what is that remedy? So Dr. Priya says phosphorus. Very important remedy. I hope you are understanding. Though the patient has pets, though the patient loves pets, has pets in his family, in his home, but has dreams that animals are biting him and desires to drink lot of chach. Yeah, so Dr. Saroj Ahmed says lacasis. Can you think more? Can you think more? See, it is always very easy when I am stressing on a symptom and then you go, you repertorize and you get the remedy. But when you are taking a case, what to give importance and what not to give importance is a very important decision that you have to take in split minutes, I can say, in 10 to 15 minutes. Am I right or wrong? Yes, doctors, am I right or wrong? When I'm telling you a case, specifying symptoms, it is easy to understand and prescribe the remedy. But when you take the case, it is difficult to prescribe because you don't know which symptom to give what weightage. Am I right or wrong? Yes or no? Anybody? I'm very happy today. Lot of doctors are yes. Dr. Vishaka says elapse. So this is how you enter the case, and we prescribe the remedy elapse. We prescribe the remedy elapse, and as it is said that when you have good mental symptoms, you have good case taking, and you have prescribed to core symptom, you have to give high potency. But at that time, I had elapse only 30 potency, so I gave the patient elapse 30, and you will be surprised, not surprised, because the remedy was right. In 1 month's time, I already told you the scan was normal. We just gave him one dose of elapse 30. So this is how you have to take out the core symptoms from the patient and then prescribe. So this is how sometimes dreams come to our rescue. Now a lot of people are telling me, sir, tell something about the forehead. Yes, I'll tell something about the forehead. I'll take a good webinar, a good Zoom meet or a Google meet only on forehead prescribing. But today I just wanted to share different ways of prescribing, because when you take the whole case, sometimes you are confused how to take the case, how to repertorize, and which symptom to take for prescription. So today half an hour passed very early, very fast, and yeah, Dr. Jani says add me on my WhatsApp. Your number is 8000283990. Yes, I have uploaded a case I think 2 days back of hypercholesteremia, and we have discussed the case. No, I think not of cholesterol, but of I think GIT. We have discussed that case. Today I'll put the answer of that case on the repertory chart also. If you understand my way of prescribing, I'll tell you how do I prescribe sometimes only on mater medica, only on one or two symptoms that clicks me and that tells me that this is the way of prescribing. I don't always go from the whole format and take this all the symptoms. What the symptom which are PQRS, as Hahnemann says, PQRS symptom that strikes you and that gives you the remedy. So today this is all from me. 3 cases I have discussed in a short span of time. I do have the video of the case, but I cannot do the video thing because the time is too short. I hope you liked my YouTube. If you do like, do share and subscribe, because next time I'll take something about the hairs, then about the skin, then about the nails. Lot of different ways of prescribing. It's a beautiful way of prescribing. I enjoy prescribing this way because the results is guaranteed, because it is such a precise prescription that the results are guaranteed. Okay, so I hope everybody enjoyed this case today. Yes or no? Yes, everybody enjoyed today. Yes or no? I have no answers. I hope you don't get bored when I'm speaking about the cases, because everybody wants mater medica. But sometimes the cases guide, the symptoms guide you to the remedy. Yeah, so only I think one doctor enjoyed today. Next time I'll try to make my presentation much better, I think. Yeah, so yes, Dr. Sabna enjoyed, Dr. Sarita enjoyed. Yeah, that also gives me boost that people keep enjoying what I try to practice. And yeah, Dr. Sandeep, Dr. Vishaka, yeah, thank you so much. In fact, if you see dreams of animals biting him, there are 3 remedies which I have prescribed in my cases. Yeah, so the remedies are Zincum metallicum, you have to understand, Veratrum alb, and Pulsatilla. In fact, I had a beautiful case of Veratrum alb, where the patient had a dog, but the patient had gone out for maybe he had taken a leave from his, he had taken for a holiday, gone for a holiday, and when he came, the patient found that his dog had died. And because of the closeness of the dog, the patient had dreams of that dog biting him in his dreams. The dog trying to take revenge. So he felt that he had an esteem problem, and I gave the patient Veratrum alb, this time 1 ml single dose, and that dream vanished and the symptoms of the patient got relief. See, this is how you enter the case, just by a dream. So dream of animals biting him, Veratrum alb, gives me a fantastic results. Yeah, so this is all for today. In fact, I have only take YouTube live for half an hour. Now it is already 40 minutes. I can keep going and discuss a lot of cases, but sometimes time is also important, time schedule. Thank you for joining me. This Wednesday 4 to 5 I'll come Facebook live. If you have any questions, you can ask me on Facebook. And yes, everybody is trying. Everybody is on WhatsApp, Instagram, telling me start the Matri Medical classes. I'll definitely start the Matri Medical classes. So thank you, doctor. Thank you for joining me. Meet you on Wednesday, 4 to 5 on Facebook Live on question answer session. Thank you.